Good morning, my name is Mayleen Mercado. I am a nursing student and I am going to be doing a maintenance of my peg feeding on the patient. So the first thing I want to do is I want to check my doctor's orders. I want to make sure that I have all my equipment that I need. I have my sterile water, so I would open it, put in my 30 cc's of sterile water. Once I do that, I'm going to ID the patient. This is indeed my patient. I'm going to explain the procedure. I'm going to lift up the bed to a comfortable working position. Bring the head of the bed to a 45-degree angle. I'm going to wash my hands, put on my gloves. I would ask the patient if they're having any nausea. My patient has not been having nausea, so that's a good sign. I'm going to auscultate for any abdominal distension, so I'm going to listen to all 4 quadrants. Okay. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Bowel sounds are present. If no bowel sounds were present, I will listen for 5 minutes in each quadrant before determining that the bowel sounds were absent, but in this case, they're present. So the next thing I want to do is I want to put a towel underneath, just in case. I don't want my patient to get dirty. Okay, so I'll put my towel there. I will turn off the feeding. Kink this, remove the feeding. Put this on top of the towel.
So yeah, so then I got the stuff.
That. And I'm just going to aspirate back 5 to 10 C's, if not more. Make sure there isn't more than 100 cc's. There isn't more than 100 cc's, but if there was, I would discontinue the feeding, turn everything off, and call the healthcare provider. But in this case, my patient is okay. I have noted the color, the amount, and any particles, and if there's any blood, everything seems okay. So now I'm going to just insert it back into the patient. Take that. I'm going to take my 30 cc's of sterile water or tap water. So I'm going to make sure that I have that. And I'm going to slowly insert it back into the patient. Okay, so I have done that. I'm going to kink that. I'm going to connect my tube feeding. Okay, that's connected. Okay, garbage. I want to make sure I bring my side rail up to prevent my patient from any risk of falling. Bring the bed down, but I will leave the patient in an upright position. Okay, I'm going to turn on the machine, and if there was any feedings in here, I would just continue the feeding, and that I would add another feeding to the patient. If it was 2 feedings, I would add 1 at a time so that it can be nice and fresh. Remove my gloves. Wash my hands, and I want to document in my nursing notes the intake and output. That was my video for peg feeding. Thank you so much for watching.